Imagine waking up one morning after your 60th birthday feeling completely normal. You make your tea, open the curtains, and step into the day without discomfort. Yet inside your body, your arteries may be working harder than they should. High blood pressure often rises quietly without dramatic warning, especially after 60. Many adults are surprised to learn that high blood pressure is often called the silent condition. Unlike pain that demands attention, elevated blood pressure can exist for years without obvious symptoms. That silence is exactly what makes it so important to understand. After the age of 60, your blood vessels naturally begin to lose some of their flexibility. When arteries become stiffer, the heart must pump harder to push blood through them. Over time, this increased pressure can strain delicate organs like the brain, kidneys, and eyes. Blood pressure is measured using two numbers. The top number, called systolic pressure, reflects the force when your heart contracts. The bottom number, diastolic pressure, measures the force when your heart rests between beats. Both numbers matter, especially as we age. As the years pass, it is common for systolic pressure to slowly increase. This doesn't always mean danger, but consistently high readings can raise the risk of stroke, heart disease, kidney damage, and memory problems. The key is not panic. It is awareness. It is important to say clearly, many people with high blood pressure experience no noticeable symptoms at all. That is why routine monitoring is essential. However, in some cases, the body may offer subtle signals that something is not quite right. These signals are not dramatic. They are often easy to dismiss. A mild headache, a little dizziness, slight fatigue. But when these small changes appear consistently, especially in someone over 60, they deserve attention. Today, we will walk through 7 subtle signs that may indicate your blood pressure is rising into a range that requires medical attention. This is not about fear. It is about early recognition and protecting your independence. Before we begin the signs, it helps to understand why blood pressure becomes more sensitive after 60. Aging affects the inner lining of blood vessels. Over decades, cholesterol deposits, inflammation, and natural stiffening reduce elasticity. Think of a brand new garden hose. When water flows through it, it expands easily. Now imagine that same hose after years in the sun, less flexible, slightly rigid. Your arteries behave in a similar way as you age. When arteries lose elasticity, pressure builds more quickly inside them. The heart must compensate by pumping with greater force. Over time, this additional workload can enlarge the heart muscle and increase strain on the circulatory system. This process does not happen overnight. It develops slowly. That is why regular blood pressure checks are so valuable. A simple cuff at home or at a pharmacy can reveal information that your body may not clearly announce. For most adults, a consistent reading above 130/80 may warrant discussion with a healthcare provider. Numbers significantly higher than this, especially above 180 systolic, require urgent evaluation. But again, context matters, and individual guidance is essential. Now let's explore the subtle signs. Remember, experiencing one of these occasionally does not automatically mean danger. Persistent patterns are what matter most. The first subtle sign to pay attention to is persistent morning headaches. This does not refer to an occasional headache after a poor night's sleep. It refers to headaches that appear repeatedly, especially upon waking, without an obvious cause. Many adults over 60 describe this type of headache as a dull pressure or throbbing sensation, often located at the back of the head. It may improve gradually as the day progresses, which makes it easy to ignore. Why can this happen? During the night, blood pressure naturally fluctuates. In some individuals with uncontrolled hypertension, pressure may rise significantly in the early morning hours. This increased pressure inside blood vessels in the brain can trigger discomfort. It is important to emphasize that most headaches are not caused by high blood pressure. Stress, dehydration, sleep issues, and tension are far more common causes. However, when morning headaches become frequent and unexplained, they deserve medical evaluation. If a headache is sudden, severe, or accompanied by confusion, weakness, or vision changes, it requires urgent medical attention. Those symptoms are not subtle and should never be ignored. The second sign is unusual shortness of breath during activities that were previously easy. This does not mean breathlessness after climbing several flights of stairs. It refers to feeling winded during mild exertion that once felt comfortable. After 60, the heart must sometimes work harder to overcome stiffened arteries. If blood pressure remains elevated, the heart muscle may gradually thicken. Over time, this can reduce how efficiently the heart pumps blood. When the heart struggles to pump efficiently, fluid may begin to accumulate in the lungs. Even small changes in lung circulation can create a sensation of breathlessness, especially when lying down or walking short distances. Again, shortness of breath has many possible causes, including lung conditions, anemia, or reduced physical conditioning. But if it develops gradually without a clear reason, especially in someone with known hypertension, it should be discussed with a doctor. Persistent breathlessness, chest pain, or fainting should never be managed at home. Immediate medical care is necessary in those situations. The third subtle sign is recurring dizziness or lightheadedness. This may feel like brief unsteadiness when standing up, or a sensation that the room is slightly spinning. Blood pressure plays a critical role in maintaining steady blood flow to the brain. When pressure fluctuates significantly, either too high or unstable, the brain may temporarily receive inconsistent blood flow. In older adults, the body's ability to regulate pressure shifts can become less efficient. Rapid changes in posture, dehydration, or medication adjustments can contribute to these episodes. Most brief dizziness episodes are not emergencies. However, if dizziness becomes frequent, leads to falls, or is accompanied by weakness on one side of the body, slurred speech, or vision loss, immediate medical attention is required. Even mild but recurring dizziness in someone over 60 should prompt a blood pressure check. Sometimes the numbers tell a story before symptoms become more serious. The fourth sign involves subtle changes in vision. Many adults assume vision changes are simply part of aging, and often that is true. However, persistent blurred vision can sometimes signal elevated blood pressure affecting the small blood vessels in the eyes. The retina contains delicate vessels that are sensitive to pressure changes. When blood pressure remains high for extended periods, these vessels can narrow or become damaged, affecting clarity of vision. This may present as difficulty focusing, mild blurriness, or seeing spots. In severe cases of uncontrolled hypertension, sudden vision loss can occur, though this is less common and more urgent. Routine eye exams are particularly valuable after 60 because eye specialists can often detect early signs of blood vessel changes linked to hypertension before other symptoms develop. If you notice sudden vision disturbances, severe headache combined with vision changes, or loss of sight in one eye, seek emergency care immediately. These are not subtle warning signs. They are urgent ones. So far, we have discussed morning headaches, unusual breathlessness, dizziness, and vision changes. Each of these can have many causes, but when they appear consistently or together, especially in someone over 60, checking blood pressure becomes a simple and important step. The fifth sign is occasional nosebleeds. This is one of the most misunderstood symptoms related to blood pressure. It is important to clarify that most nosebleeds are not caused by hypertension. Dry air, allergies, sinus irritation, or minor trauma are far more common causes. However, in cases of severely elevated blood pressure, fragile blood vessels inside the nose can rupture more easily. When blood pressure rises to very high levels, it increases stress on small, delicate vessels throughout the body. The nasal passages contain many of these tiny vessels close to the surface. If nosebleeds become frequent, difficult to stop, or occur alongside headaches or dizziness, it is wise to check blood pressure promptly. A simple measurement can provide important information. That said, an isolated nosebleed without other symptoms is rarely a sign of dangerous hypertension. Context always matters, and patterns are more meaningful than single events. The sixth sign is chest tightness or discomfort. This symptom should always be taken seriously, especially after the age of 60. High blood pressure forces the heart to pump against greater resistance. Over time, this can reduce oxygen supply to the heart muscle itself, particularly if coronary arteries are narrowed. Chest discomfort may feel like pressure, squeezing, heaviness, or burning. It may occur during exertion or emotional stress. Sometimes it radiates to the arm, neck, or jaw. It is critical to understand that chest pain should never be dismissed as simply high blood pressure. Persistent or severe chest pain requires immediate medical attention to rule out heart attack or other serious conditions. Even mild recurring chest pressure in someone with elevated blood pressure deserves prompt medical evaluation. Early detection can prevent far more serious complications. The seventh and often overlooked sign is persistent, unexplained fatigue. Many adults assume fatigue is simply part of aging. While energy levels may shift over time, extreme or new fatigue is not something to ignore. When blood pressure remains elevated, the heart must work continuously against increased resistance. This added workload can gradually reduce the efficiency of circulation. If tissues and organs receive slightly less efficient blood flow, a person may feel drained, even after adequate rest. Daily tasks may feel more tiring than before. Fatigue can have many causes, including thyroid imbalance, anemia, sleep disturbances, or medication side effects. But when combined with other subtle signs we discussed, it may signal cardiovascular strain. Pay attention to patterns. Has your stamina declined noticeably? Do simple activities feel heavier than they once did? If so, a blood pressure check is a simple place to start. Now that we've explored the 7 subtle signs, let's talk about why blood pressure becomes more concerning after the age of 60. With aging, arteries lose elasticity. This natural stiffening increases systolic pressure and makes sudden spikes more likely. The cushioning effect of flexible vessels gradually diminishes. Elevated pressure over time damages the inner lining of arteries. This accelerates plaque buildup, which narrows blood vessels and further increases cardiovascular risk. The brain is particularly sensitive to pressure changes. Uncontrolled hypertension significantly increases the risk of stroke and may contribute to memory decline over time. The kidneys are also vulnerable. These organs rely on delicate filtering vessels that can be damaged by prolonged high pressure, leading to gradual loss of kidney function. Perhaps most concerning is that organ damage can occur quietly, without dramatic warning. This is why routine monitoring and early management are so important. The encouraging news is that blood pressure is one of the most manageable risk factors in modern medicine. Small, consistent actions can make a meaningful difference. First, consider regular monitoring. A validated home blood pressure monitor allows you to track patterns. Measure at the same time each day and record the readings to discuss with your healthcare provider. Second, reduce excess sodium intake. Processed foods, canned soups, and packaged snacks often contain hidden salt. Choosing fresh, whole foods can help lower pressure gradually. Third, prioritize gentle daily movement. Walking for 20 to 30 minutes most days of the week improves circulation and helps arteries remain more flexible. Fourth, manage stress. Chronic stress hormones can elevate blood pressure. Deep breathing exercises, prayer, meditation, or quiet outdoor time can support emotional balance. Fifth, maintain a healthy weight. Even modest weight reduction can significantly lower systolic blood pressure in many individuals. If medication has been prescribed, take it consistently and discuss side effects with your doctor rather than stopping abruptly. Modern treatments are highly effective when used properly. Most importantly, schedule regular medical checkups. Early adjustments in lifestyle or medication can prevent long-term complications. Remember, not everyone over 60 will experience these signs. Many individuals live long, active lives with well-managed blood pressure. The purpose of understanding these subtle symptoms is not to create anxiety. It is to build awareness. Awareness allows you to act early, before serious damage occurs. If you notice persistent changes, morning headaches, unusual breathlessness, dizziness, vision changes, nosebleeds, chest discomfort, or fatigue, a simple blood pressure check is a wise and proactive step. Protecting your health after 60 is not about fear. It is about preserving independence, clarity, and strength for the years ahead. If you found this information helpful, consider subscribing to the Vital Age Clinic. We focus on clear, evidence-based guidance designed specifically for adults who want to stay informed and proactive. Your health journey does not end at 60. With knowledge and consistent care, your most vital years may still be ahead.